watching Fox in the Morning, your station for balanced news coverage.
Thanks, Jim. In Health Watch, 80% of people over the age of 30 experience back problems. And for those with severe spinal conditions, about 1 million people last year turned to surgery to correct their problems. But which procedure is right for you, and are there other treatment, new options available to you? Joining us today is local neurosurgeon Dr. Mark Stern. Thank you for coming in.
Good morning.
Yeah, so most people have some sort, as they get a little older, a little bit of back pain or backache. When does it become so severe that you need to consider other medical options like surgery?
After you've exhausted your conservative options, which could be medicine, physical therapy, or chiropractic, rest, when those options are exhausted, then we go to more invasive procedures.
Now, you're saying just when they can't really move or function with it at work, it's just debilitating? Or?
Debilitating, and they say that their pain, when we use a pain scale of 10, it's an 8, 9, or 10, where they can't function, they can't get in the car, they can't walk upstairs, they can't even dress or ambulate.
What are the choices available right now, with starting with the less invasive procedures and then obviously up?
Well, we have a policy in my office called incremental increasing intervention, which means you start little and then you go big. So the start would be rest, a few days of rest, medications, which could be non-narcotic or narcotics, then therapy, which could be chiropractic or physical therapy, and then after that, things like epidural steroid blocks or blocks in the joints, pain blocks, and then minimally invasive surgery, which we do, which is an outpatient type of disc procedure. We use either laser, microwave, or other technologies to remove ruptured discs and herniations. And then you need open surgical procedures, which is microsurgery, where you take out the disc, and lastly, fusions, which are basically stabilizing procedures where the bone and the disc and everything is so bad that you have to stabilize it with a fusion.
Now, fusion can be very challenging, because you're saying you were going to show us what that is like. Now, that's traditional, and there's actually some new clinical studies and new devices that you're working on. But try to show me the difference between the traditional surgery right now with spinal fusion, where you basically don't have much mobility, right?
Well, this is a traditional surgery. This is a model for scoliosis, which I think most people know is a curvature of the spine. And basically, a rod's placed in, and bone is taken either from the hip or cadaver and laid here, and it fuses over 6 months to a year. What that does is it stops movement totally, but it also stops pain. This is a standard that's been around since the 50s.
Okay.